we'll make a start. We'll welcome everyone. Welcome to the Oxford Psychiatry Group webinar on CBT. And we have our resident expert, who is Natalie Dean. She has many talents, many qualifications. I'll say a little bit about Natalie, and then she can also add uh, bits about what she does. There's quite a lot. And actually, she is a CBT therapist and also does EMDR. She's involved in medical education and teaches medical students and works with the University of Nottingham. And actually, congratulations are in order because Natalie's just finished a medical education degree today. So many congratulations, Natalie.
Oh, thank you.
Would you like to say anything else in terms of introduction for yourself?
I don't think so. I think I'm a mental health nurse by background. So that's sort of, yeah, background's been community mental health, um, forensic prison background before that. But yeah, I think that generally covers it pretty
So
much.
greatly experienced in psychiatry, psychological therapy. I know being a CPN has lots and lots of aspects, and is like hard work, as I'm sure working psychologically in prison is as well. For people who don't know me, I'm Dr. Max Malik. I'm a consultant psychiatrist with experience in both general adult and older adult medicine. But we're going to start by, I think, asking one of the apparently simple questions of Natalie. So, Natalie, what is CBT? What people, hear this term bandied about, and I'm having CBT, you're going for CBT, but really, somebody say alien landing from somewhere else and does never heard of this term. What does that actually mean for you and for us?
Yeah, it's a good question, which does sound quite simple on the surface. So, I think the first thing to outline is it stands for Cognitive Behavioural Therapy. So, some people literally say, "What does CBT stand for?" as the first question. Cognitive Behavioural Therapy. So, I suppose that if we break that down, we're looking at thoughts, the cognitive part, and the behaviours, so the behavioural elements. And it's a psychological therapy. So, ultimately, where it's a very structured, evidence-based psychological approach to working with different presenting problems, really.
Hmm.
Do you want me to talk a little bit more about that? How that
Um,
might look?
okay, so that is what it is. It's cognitive behavioral cognitive, I think, means thinking, doesn't it? And behavioral
Yeah.
means behaviors, and therapy means treatment. So it's about thinking, behaviors, therapy. Okay, so give us a little idea, please, Natalie. What if I don't know what does that look like? If I came to you, let's say, and I said, okay, and you said to me, right, Max, we're going to start CBT. What does that look like?
Yeah, I think to break it down more, really what we're looking at is the link between thoughts, feelings, and behaviors.
Hmm.
So the interlink between them all and the kind of mind body link that actually a thought can impact on how we feel. So I always see it like we're very good. Well, most of us are quite good at recognizing how we feel often. So you might hear people say, "Oh, I'm really stressed at the minute. I'm really, feeling a bit low." Often that is it's good that we can recognize how we feel, but actually that stems from our thoughts a lot of the time. And then as a result of that, we've got behaviors that we then do. So often they'll feel helpful to us and they might be helpful, but sometimes they're not so helpful. So, really, what we're kind of looking at is the interlink between thoughts, feelings, and behaviors in a very simple way. So, if someone was coming to me saying, I've heard about CBT and I'm wondering if it might be helpful for me, really, the first thing we want to do is sort of explain that's what CBT is. So, we're looking at thoughts, feelings, behaviors. We're looking at how they link together and how sometimes we have unhelpful thoughts and unhelpful behaviors, and they kind of keep us a little bit stuck. But I suppose really what we want to know is because CBT is very goal focused, we'd kind of want to try and understand what is the presenting problem that someone wants to work on. What are the goals that someone wants to set as a result of that?
So just so that I can understand that better, would the goals, if I were coming to you, would the goals be set by me, by you, or by a combination of us deciding together, Natalie?
I think a lot of the time it would be from you, but that sometimes needs support in how it looks. So, for example, someone will come to me and say, I'm really anxious all the time, or, I'm feeling really low. And so if someone was coming to me saying I'm feeling really anxious, their goal usually is something like, I don't want to feel anxious anymore, or I want to feel better.
Hmm.
So that is a goal, but it's not really very sort of measurable or specific. So how would we know that that person is achieving that goal of feeling better or feeling less anxious? So we'd have to make that more specific. So that might be, I want to be able to get on a bus and travel to this place, and I want my anxiety rating to only be 3 out of 10 during that journey, and I don't want to use any of my safety behaviours. So obviously, to understand that goal, someone's kind of got to develop their understanding of CBT and of themselves to get to that point. So we'd kind of start off with maybe a loose, vague goal of, I want to feel better, or I want to feel less anxious, or I'm having panic attacks, I don't want to have panic attacks anymore. That
Hmm.
might be what someone approaches us with, but then we work on that in the first few sessions to make that more specific and outline what is that? What does it look like? How do we know when we've
Just so
achieved
you
it?
break it down a bit more into specific things,
Yeah.
as to measurable sort of steps, let's say, or outcomes. So interestingly, you said there safety behaviors, Natalie. So what is a safety behavior, please?
The
Give me
safety
some
behavior would
examples.
be so, yeah, I think just to give an example would probably work
Mm,
bit easier. So with CBT, we'd look at a very simple sort of formulation for any problem really would be a little five area. So that would have a situation. So that might be I've run out of milk and I need to go to the shop to buy some milk. So that's kind of my situation. If I'm very anxious and I'm really struggling with that, my thoughts might be, oh, what if my card declines when I get there? What if, I don't know, maybe I've had a time where I passed out once or felt funny in the shop. What if I pass out? What if I bump into someone that I don't want to see? What if, I don't know, something happens at the shop? So those kind of thoughts trigger me to feel anxious. So I'm recognizing I feel anxious about going to the shop. That might induce some physical sensations. So my heart might start racing. I might feel sick. I might feel hot. And then I've got a behavior that I do. So that might be I avoid going to the shop altogether and think, do you know what? I'll go without my nice cup of tea tomorrow. I just won't go to the shop to get the milk at all. And I'll just forget about it. My anxiety would then sort of reduce. Or I might think I will go to the shop, but I'll go really late at night when no one else is there. Or
mm,
I'll take cash out of the machine so I know I can afford to pay for this item.
mm.
Or I'll get a trolley and I'll lean on that because that will mean I'm less likely to pass out. Or I'll go with someone to the shop. So I suppose those types of behaviour, they would be a safety behaviour. So we'd have maybe an avoidant behaviour.
Mm.
I'm not going to go at all. A safety behaviour of I'm going to go, but I'm going to do X, Y, and Z because it makes me feel better. So it sort of feels helpful in the short term. Or I might have a reassurance kind of behaviour. So I might ring you and say, do you think I'll be all right if I go to the shop? What do you think about it? And you might say, yeah, you'll be fine, just go and it's okay. That might help in the short term. So we've sort of got different behaviours that we utilise. Does that make sense?
Yeah, I think that makes great. That does make sense. So when somebody just asked in the chat about, so when you were explaining CBT overall, I mean, is that like a life coach they're asking, or is that different? I think it's very different, but what do you think?
Yeah, I think it's very different. We're kind of working towards specific goals. So, like I've said, that would be something sort of really measurable and specific, as in I'm not feeling great and I want to, it's not just sort of, oh, I want to, this is where I want to be, or this is my goal of where I want to get to in life. It's sort
Hmm.
of this is something's really impacting on me and it's really affecting my life. And I need to make a change to that specific kind of problem. So that might be if it's OCD, it might be I've got all these compulsions. It's taken me 2 hours to get myself to bed at night. I'm not sleeping, I'm not going out with friends, we're recognizing kind of a significant impact, I think, on people's life. And that usually triggers someone to kind of access something like CBT, where they say, this is the problem, and
Mm,
we want to explore what's maintaining that problem. So I think sometimes with things like coaching, it's more where I want to get to, or this is what I want to achieve in life, and how do I get there? Whereas
mm,
CBT is a little bit more sort of what's the problem, what's maintaining it, and what steps can we take to improve that or
mm.
change that.
So related to that then, Natalie, do you think CBT can give us a good skills anyway? Like for example, let's say I don't have, or somebody doesn't have literally diagnosed condition. They've never seen a psychiatrist, but CBT type skills can help us out with our thoughts, our behaviors, and therefore, our feelings and well-being. Do you think that that is something useful?
Absolutely. I'm really passionate about the fact that people should have CBT skills, basic CBT skills. I think everybody should have. I think I go and do some voluntary work in some schools and deliver some sessions to young people just
Mm,
to try and help people recognize their thoughts. Like we said earlier, we get a lot of people that I feel really anxious or I'm really struggling with this, but they can't understand why that's happening or
mm,
what they need to do to change it. So if you know that you're using these safety behaviours and they feel helpful in the short term, but actually what we want to recognise is they're not really helpful in the long term, because going back to my earlier example, I can't go to Tesco now when it's busy or without somebody, or in these scenarios, I'm kind of limiting what I'm able to do in life. And I think being able to kind of recognise what is it I'm struggling with? What's keeping me stuck with that problem? And what skills and tools can I use to improve things? So it's almost like we're building, a toolkit. We've got a toolkit. People come to me with no tools in it or very little, you might say, oh, I do a bit of mindfulness. That's great. But how can we increase that toolkit? What can we add into that? So and there's loads of skills and tools that we will give to people, and they'll have those then for their whole life to kind of utilize, and I think a big part of it is recognizing what's maintaining the problem rather than just sort of thinking, oh, I'm anxious or I'm feeling really low or, I'm having nightmares at night and I can't sleep. What's keeping us stuck in that problem, and what skills and tools have we got to make those changes? Because I think sort of growing up, certainly for me at school, and I know they're doing a lot more now with sort of recognizing how we feel. We've got feelings wheels and things, but they don't always help us to identify what's causing us to feel that way.
hmm Mm. Yeah, that's really interesting. I agree. There's much more focus on those things now in schools. I mean, so you're really saying it's gaining some insight partly, but also giving us this potentially amazing toolkit to do things with that we can utilize and in various different situations, practice when we're not with an expert like yourself, possibly, and then hopefully continue to utilize that excellent toolkit to continue to repair our, if you like, the engine of our mind with that tool. If I use a mechanics analogy, if a mechanic carries his toolkit around and he comes and fixes your car, but then you learn how to do that and you have a toolkit and you can somehow fix some aspects of that yourself. Would that be a reasonable analogy?
Yeah, yeah, and I think that's exactly what we're trying to do is build up the toolkit, give that person a toolkit.
Mm,
Really, what I'm trying to do is impart all of my knowledge to create, for someone that comes to me to make them their own therapist. So they've got those skills and tools and they know how and when to use them. So that might be someone's had therapy, they've done really well, they walk away with that toolkit, and then a few months later they recognize, oh, I'm falling back into these patterns that I was in before, or I'm starting to recognize that I'm feeling a bit low again, or I've avoided going to that social event because I felt quite anxious. Right,
mm,
I'm going to get my toolkit out, which can be, a booklet of information that they've gathered over that time
yeah.
that, right, actually, let's recognize what's the situations that's caused me anxiety this week? What's happened? Well, at work there was this meeting and this happened, and I didn't put my hand up or chip in because I was what were the thoughts that were going through my mind? Wow, I might look stupid if I say something, or so people are able to then recognize those things for themselves and then yeah utilize that toolkit. So again, going back to this example that I kind of used at the start, if someone's able to recognize actually I'm slipping back into this pattern of unhelpful behaviors and these negative unhelpful thoughts or
Mhm.
worry thoughts,
Mm.
they're able to implement a change and think, right, this is what I need to do to make that change. So that's kind of what we're trying to do. We're aiming to give someone a toolkit to use moving forward.
That's really, really useful to see it that way. And then I really loved what you said, Natalie, about you want people to, or help people to become their own therapist. And I think that's so important for every single human being and the human experience of life, the human condition that we all inhabit, actually necessitates all of us to some degree being our own therapist. And I don't believe that they'll become as skilled as you, but I think that's separate to, they can still learn lots and lots of skills. And I mean, one of the things I've gained most
Max is frozen. Have frozen?
of just being human and relationships and thoughts better over the years. So that's really useful. Coming on to that, from that, I suppose, leads on to um, just if you could tell us a little bit about what CBT is really good for. I mean, you've had lots of experience, many years of experience with CBT, and also I can talk a little bit about, or we can mention the research background. But what do you think, in your experience, CBT can be so really effective for?
Oh, it's a very long list. I think, like we've said, general day-to-day life, it just in general, to kind of help people work through day-to-day kind of problems and difficulties.
Mhm.
Um, and it's got a really strong evidence base for a lot of presenting problems. Anxiety, low mood, OCD, you've mentioned, panic disorder, bipolar, PTSD, so trauma. I do quite a bit of work with people that have had significant life-changing injuries. Um, there's probably more that I can't think of, but lots of things. Like I've got a patient at the moment that's got bipolar.
Mm.
Yeah, people are putting in the chat ADHD. Yes, I think ADHD has lots of, tends to have lots of other things along with it. So, yes, ADHD, but also that
Yeah,
comes with low mood at times, anxiety at times, and lots of the other things that I've probably just talked about.
yeah.
Um,
Now that you touched on ADHD, I'd just like to make a quick comment about neurodivergence and CBT from my understanding and tell me what you think. But I mean, I think adapted CBT is really important for people with neurodiversity, particularly ADHD, and probably even more so true for autism and autistic people, because I think standard, and there's some evidence, in fact, from University of Nottingham, interestingly, that just simple, if you like, regular CBT without adaptations is not so effective for neurodivergent people. So I think we need to think, and unfortunately, as good as some CBT within the NHS is, and we know that actually millions of people have been referred to talking therapies, or IAPT as it used to be called, within there, many people, especially neurodivergent people, haven't really had the full benefit because they've not had the services that have been able to adapt to their particular needs. What do you think about that?
yeah, I think that's really true, and it's a shame. And I think that we know these services struggle, and they're very limited on things like the number of sessions or, you know, areas that can take, waiting lists along. There's lots of kind of problems. I think they are great for what they were designed for, but often that doesn't necessarily cater for other people that it could actually help.
Yeah,
So yeah, I think finding a therapist with a background, that has experience of treating ADHD or autism, um, and being able to adapt therapy can be really beneficial. So
yeah,
that can be done in different ways, very dependent on the individual as to how you would adapt it. But yeah,
Mm.
you would definitely be making a few adaptations in things like pace, in session content, in even things like follow up information,
Mm.
so that people can take their own time to read through it clearly. Lots of things. Yeah,
Yeah, I
it
think
can be
that
adapted. Yeah.
a bit, and I think it should be to be most effective for those people. Now, not to knock the NHS CBT and the other therapies, they do a fantastic job across hundreds of thousands of people. So that's not what we're saying. I think what we're saying is despite the NHS doing a fantastic job, and I still work and love the NHS, so that's not the point. Is for certain people, it's not fully tailored to meet, and that's just because of the level of demand and services available. So it's not the fault necessarily of the CBT, but it's got to be structured and adapted sometimes. And interestingly, I'd just like to move on to you mentioned therapist. Can you just tell me the role and the importance of the therapist, or let's call it the therapeutic relation? What, I mean, is it important? Does it matter if I just go to anyone, or if I come to somebody who are perhaps like you would maybe have a rapport and understanding with? I mean, do those things matter?
Yeah, absolutely. And there's a lot of evidence to show that as well, to kind of demonstrate that your therapeutic relationship is massively important when you're doing therapy. And I think, it's about finding someone that you can build that rapport with, that you can build trust with, um, that you can just engage with on a level that you can be open and honest with. So
Mm.
therapy is only going to work if we're open and honest, like a lot of things. So finding someone that you feel like you can be really open with, without fear of judgment, and people are suited to different people. So I think, for people to be able to kind of pick who their therapist is a big part of having therapy, and it does need to be considered. I think when people are signing up for therapy, that do they feel relaxed, comfortable, like they could build that therapeutic relationship with their therapist, because yeah, it's really, really important in being able to move forwards.
Mm. Yeah, so and that's really interesting because I think one of the kind of misunderstanding when we use the word sometimes therapy, people think of the older the predated CBT, the psychoanalytic type work. And I just would like to say it's not CBT from my understanding really isn't about that. It's not really about when Aaron Beck developed it 50s, 60s, 70s is one of the most famous guys and really important in CBT work, and part of it was done at University of Oxford, and it's not really about looking back into so much the childhood or unconscious conflicts and those things. And would you agree with that? It's more in the here and now. Is it more? It's not about sort of unresolved unconscious conflicts and things like that.
Yeah, I would agree with that. I think, again, like NHS services, some services are limited on sessions, and I think
Mm.
sometimes that can lead to sort of surface level CBT, I would kind of call it,
Hmm.
which can be useful. So, that'd be some of the things that we've talked about. So here and now, this is a problem now,
Mm.
and I want to feel better. I want to be able to go to the shop. I want to be able to get on a bus. I need to be able to do these things.
Mm.
And I think that's sort of more here and now, is this is the problem. This is what's keeping me stuck. Let's put these tools and skills into place to kind of help me manage that currently and feel better. But I think CBT does look at the past. So really what you'd want to do is build what we call a longitudinal formulation. But ultimately that's just looking at what was our past like. So you're right, we wouldn't necessarily delve into all of those things, but we'd want a good understanding of what was childhood like, what was our school like, what were our family like, what were our relationships like, that kind of early childhood. We want to know about that because that contributes to where we're at now. So if I've grown up and had a really critical mum who was really overbearing and put, lots of emphasis on me working hard and doing well at school and criticized me a lot, then that's going to impact on where I'm at currently. So I might have developed perfectionist traits. I'm really anxious, and that's so it's important that we understand what's contributed.
So what
to
makes
where
them
we're at
work as
now.
well?
Yeah, but we don't necessarily go into that as much.
Trying
And I
to
think,
resolve. Yeah.
yeah, for people to kind of understand, right, that makes sense. We're trying to make sense of that, make sense why I feel anxious
Hmm. Hmm.
submitting my university essay because,
Yeah.
I've grown up with this pressure or I've grown up with this kind of outlook on life, or actually things were really hard for me as a child. And,
Mm.
I didn't have my parents around a lot. So, so we want to understand it and we want to, I've always had people pleasing beliefs or rules that I've lived my life by, and I've brought that into adult life. So we want to make that connection. But
Mm.
yeah, we're working on more here and now. This is our problem that we're working on currently. This is the goal we want to achieve.
So one of the questions we've got in the chat, Natalie, is can CBT help with relationships? And I think that's a big one for almost everyone I know. So can CBT help with relationships?
Yeah, definitely. And I think relationships factor into a lot of someone's what's maintaining the problem for someone, or what people are finding difficult, doesn't it? So, I'm working with someone at the moment who, individually, but a lot of what comes up is around managing her relationship, with a partner, or, sometimes it's, for example, like OCD is quite a good example, is that relationships with family sometimes maintain the problem. So if I've got someone reassuring me all the time, or if I'm going to someone, again, patients that have will kind of get family members involved in their rituals or their compulsions. So actually we need to sometimes do a bit of work with the family as well. So they develop their understanding of what's going on.
Hmm.
Um,
Yeah. So interestingly, about you mentioned OCD. Now that stands for obsessive compulsive disorder, of course. But just so that we can all understand, is that are you referring to people like excessively tidy or worrying about being on time? What does that look like from a CBT therapist's understanding of OCD, Natalie?
That's it. Yeah, it's a good question. I think it's sort of overused, the term, isn't it? We will probably know someone that said, "Oh, it's just, I'm a bit OCD." That term crops up quite a lot, but I think actually, OCD is very debilitating for a lot of people. And really that's based on our intrusive thoughts. So we've got really significant intrusive thoughts,
Mm,
and we apply meaning to those ultimately within OCD. So they mean a lot, and
mm,
then that causes us distress.
mhm.
So
Yeah.
um, yeah, I
So
don't know if you want me to go into examples, but
we've got some really interesting. We could talk. There's so many dimensions and aspects, aren't there, Natalie, that we could discuss. But a brief, I think, from my understanding, a brief summary is CBT is a fantastic toolkit to help, even if you're not being so-called diagnosed or under care of a psychiatric team as such, or so. But it's fantastic to help us think about ourselves, gain insight, and then cope with some of the feelings and behaviors that result. It's very, in my understanding, it's very good for anxiety, depression, OCD, sometimes even physical pain and conditions that are hard to treat or medically sometimes unexplained symptoms, in fact. And somebody's asked the question that kind of relates to that saying, is it good for, the exact question is it good for psychogenic non-epileptic seizures? So I think these would be called, yeah, non-epileptic seizures, which means they don't result from a misfiring of neurons in the brain, but rather are, if you like, non-organically generated, non-physiological, so perhaps with a psychological element with them. Do you think CBT could help with
yeah,
that?
definitely. I think this is becoming more well known as well. So the evidence base is kind of building for this. Um,
Mm,
yeah, for sort of that. I think that we're working on changing the term medically unexplained, aren't we? But yeah, typically sort of
mm.
medically unexplained symptoms. Um,
Yeah, some people call
Functional
functional, some
neurological,
people.
yeah. So yeah, there's
Some
kind of
people call,
growing evidence
mm,
around that, and growing work being done as well. Some really good work being done around that.
mm.
So yes, CBT can definitely help with
Yeah,
that.
I've got a really interesting couple of questions here. I'm going to go. Somebody's saying, how do I know if I need CBT? Like, so that's really interesting. How do I know then? When do I come to someone like you, Natalie?
Yeah, that is a really hard question. I
Yeah.
think for me, because for me, I am really passionate about the fact everybody should have these skills and tools. And what happens is people wait until they become really unwell or they're really struggling to manage and cope with life for whatever reason, whatever area that might be, before they access help. And I
Hmm.
think that tends to be a lot of how we work, especially within mental health as well. There's lots more being done now around mental health prevention.
Mm.
Um, but I don't think you necessarily need to wait for anything. I think it's just you could have some sessions to just learn what are these basic skills that we're talking about? What are some of them? Can I just recognize maybe some of the things that I'm struggling with and some
Mm.
of the tools that might help? Because we all struggle with things. Even being on here for me
Mm.
today is,
Mm.
you think, oh crikey, what if I say the wrong thing? What if, everyone finds it really boring? You've got these thoughts. They
Mm.
make me feel quite
It's totally
anxious.
human, isn't it, really?
Yeah,
Just
it's
human,
human,
being
definitely.
human, I think. Yeah. Yeah.
Yeah.
So
So
another,
yeah, I wouldn't say you need to wait for anything,
oh,
but
I
I
agree.
think
Yeah.
what it's more the impact. What is it that I'm maybe not doing? Have I
Mm.
stopped? Am I putting off going out with my friends?
Mm.
Have I withdrawn and I'm not engaged in anything anymore? Are we recognizing that there's things we'd like to change,
Yeah.
and CBT can kind of help work
Change
towards those?
or improve perhaps our thinking and feelings in certain context, or perhaps some get over difficult. Somebody's asking, procrastinating at university exams and things like that. Is that something that you think it could be helpful for? Practical tips they're asking about avoidance, procrastination, anxiety, things like that. Um,
Yeah, definitely. I think a few practical. I think again, understanding what's going on in that scenario. What's the thought process? What are the thoughts impacting on how I
mm,
feel? So we're kind of feeling anxious, we've got avoidance in there, so that's our behavior, isn't it? So we want to look and understand that a little bit more. I think practical tips for people that are doing exams and at uni is having that dedicated workspace is always a practical tip.
mm,
Um, and what generally sort of things like that is what is it we're worrying about? So so perfectionism, for example, crops up quite a lot. So I'm not saying
mm,
this person has that, but
yeah.
often procrastination is kind of linked to perfectionism of
Mm,
my self-worth kind of based on how well I'm doing and my achievement level at university or in work or wherever. And
mm,
then I've got kind of unhelpful behaviors. So I'm going to rewrite this essay 14 times. I'm going to seek this reassurance to know is it okay and check it over and over again. Or so, and actually, is it easy to just avoid it until I really have to do it because it's quite difficult and distressing to
mm,
do? So we get into this habit of avoidance. And I think often with behaviors, they feel quite helpful in the short term, but in the long term, we would generally label them as unhelpful.
mm.
Does that make
Okay.
sense? So a lot of the things that feel helpful, I'm not going to go to this party, I'm going to avoid doing this work because it's making me anxious. It's quite
Yeah.
helpful, but
Mm.
only in the short term, and then the long term,
So
we
it can
don't
be quite
really feel.
detrimental to our quality of life in the longer term.
Yeah,
Mm.
yeah.
So we have a really another interesting question. Somebody's saying that about bipolar. You mentioned bipolar. If somebody's living with mixed episodes, which means both elevated mood and intermittently depressed mood or mixed features, you can have a mixed condition in bipolar. So and let's say they're on some medication, but they're still having these sort of mixed episodes of low and elevated mood. And those symptoms associated sometimes are things like irritability or, sleep difficulties and emotional regulation, in fact, is also one of the prominent features. Do you think CBT can help in those mixed episode situations?
Yeah, I'm working with someone with bipolar at the moment, actually, and we're doing some work around sort of like behavioral activation, more behavioral planning for things. So actually, can I recognize when those moods change, when those episodes are happening?
Mm-hmm.
What's triggering them?
Hmm.
What's my thought process? Can we work on some little formulations? So I'd get them doing some formulations as to looking into those things. What's triggering it?
Sorry,
What's
Natalie,
because
what's formulation?
sorry, yeah, formulation. So that's kind of like a what's the triggering event, what's going on, and
Mm,
then what are our thoughts that are associated with that? What thoughts come from that situation?
mm,
What's the feelings that I get? What's the physical associated feelings? And
mm,
what's my behavior? So a little kind of mini formulations, mini little 5 areas of
mm.
thoughts, feelings, physical sensations, and behaviors. So we want to
So,
try and understand
yeah.
those.
And is it like a circle? Is that like it could be like a diagram where one sort of impacts the other? Is that how it works?
Absolutely. Yeah. They all impact each other, I
Mm,
think, is what's key. So for some people, that might be so if you had panic disorder, you might recognize a physical sensation first or feel like that's what's, and then that's escalated by thoughts. So
mm,
this, am I going to die? My heart's racing. What if I collapse? This is
mhm,
the end. And then
mm,
that causes us to feel really anxious. So, but it equally, it might be if I'm quite depressed, I might have negative thoughts about myself. I'm such a failure. I've wasted my life. I'm lazy. These kind of negative thoughts impact how I feel. So that's not going to make me feel very good. And then I've got those behaviors associated. I withdraw even more, don't answer my phone, I phone in sick for work, whatever it is. So understanding, I think, in any disorder that we're looking at, understanding that key little mini cycle, mini formulation, 5 areas that they're called sometimes, understanding
mm,
those for lots of, you know, um, events through the week
mm.
is a key. So we want to before we can change anything, we need to recognize what the problem is and what's maintaining the problem.
So those thoughts that you mentioned there, are they sometimes called automatic negative thoughts that we all sometimes have about ourselves? And is that one of the core sort of target areas in CBT?
Yeah, absolutely. So if we're looking at thoughts, we're kind of looking at those. I like to call them gnats. So
Mm,
negative automatic thoughts.
mm,
Um, so yeah, kind of come into our head, don't they? So I think a good example I always lean on is, if my boss said to me, "Oh, Natalie, have you got a minute? I just need to see you in my office." What would be the thought that would come into mind? That would be more than likely for most people some sort of negative automatic thought of, oh my God, what have I done wrong? Why does my boss want to see me? So it's
mm.
that sort of, we're getting automatic thoughts around,
Yeah.
you know, negative things. So, oh, what's the point anyway? Because I'm only gonna, I've just submitted my uni essay today. Oh, what was the point? Because I'll probably fail it anyway. That's a really negative thought. So we work on challenging and changing those negative thoughts. Or we might
Mm,
get more worry thoughts. So
mm,
especially if we're feeling quite anxious, that would be more related to worry thoughts, which tend to be what if? What
mm,
if I make a fool of myself? What if something catastrophic happens? What if the house burns down? What if this happens if I leave all the plugs on? What if? So we want to recognize what are the thoughts, what are they connected to? So we're kind of working on different thoughts depending on what the presenting problem is, if that makes
yeah.
sense. But then
Yeah.
from those thoughts, we've got feelings and behaviors that we use to manage.
Okay. That's great. Why I'm just looking for there's been a poll that's been conducted and I'm not sure what where it is. It's somewhere in these notifications, but maybe somebody can send us the summary of it in our IT support. But what I'd like to discuss while we're finding that, is somebody will help us. But the so okay, those are so CBT really is one of the most studied of all psychotherapy, probably the most studied, and it has, numerous meta-analysis, which means analyzing lots of studies together to increase the power. And it's been shown beyond a doubt that it works exceptionally well when done properly, well in certain conditions more than others. So it's one of the most effective tools that we have. It's changed psychiatry in the modern era, I would say. But I'd like to ask you, Nat, what conditions do you think it may be not so good for, or perhaps you wouldn't necessarily treat someone if they came to you? What do you think CBT is, you would be a bit more cautious about?
Oh, interesting question. I like these questions.
You like
Um, I
that?
think, I mean, I don't think there's anything in particular that you would be, categorically rule out because I think most problems have associated anxiety, impacts on mood,
Yeah.
struggling with overthinking, those kind of things. But I think there's evidence that would say other. So, for example, personality disorder,
Mm,
DBT would potentially be more appropriate for personality disorder. Um, Eating disorders, again, DBT has a lot of evidence base around um, DBT for eating disorders,
right.
although there are specific branches of CBT that would work with different disorders. So, for example, CBTE would be CBT for eating disorders. Again, there's CBT for psychosis. Um,
Oh,
I
just
mean,
love.
EMDR is also, in the mix, especially with things like trauma.
Uh-huh.
So, we might, if someone might decide would they work with a CBT approach to trauma or would they choose an EMDR approach? Again, very dependent on the individual. And
I'm going to come back to that because that just is a few things there. That's a whole package in itself. But can we, which we may need to talk about some. But I've just found the poll, and the top two things are, one is how do I get help with, or does CBT help with overthinking, and that's number one. And second to that is stress. So overthinking and stress. Can you help us there, Natalie, please?
oh, I can try. Yeah. So I think overthinking is massive, isn't it? And I would say the first key with that would be, can we recognize that we're overthinking for starters? That sounds quite simple, but I think a lot of the time when we're overthinking, it
Mm,
means we've had a thought and that's led to another thought and then another thought and another thought from that. And then we've sort of, what I would say, spiraled or snowballed into some probably catastrophic thought by the end of it. So, going back to the example of my boss has asked me, can you come and see me in my office? My initial thought is, oh my God, what have I done wrong? But that thought could very easily sort of spiral into, well, if I do lose my job, how will I pay for my house? Oh my God, I'm going to be homeless. My children won't have a home to live in. I'll have to sell everything, and I don't know, I'll end up stealing from a shop, or so, we kind of get into this massive spiral of from one thought through to lots of thoughts,
things that might
and end
never
up somewhere
happen,
completely different at the end.
but those things might never happen, possibly.
Yeah, so I think if we can recognize and kind of catch that
Mm,
we're in that spiral or that we're starting to overthink,
mm,
then that's a good point of, I'm starting to overthink. Whatever that's about, finances, relationships, are we sitting at night watching TV? Are
mm,
we on a Netflix series and we're actually not really watching it? We're sat there thinking about loads of potential problems or things that have gone on in the day. So are we ruminating about past events? Are we worrying about the future? We need to kind of recognize I'm I'm overthinking in whatever way that is. So
mm.
sometimes tools would be maybe writing some of those things down to get them out of our head can be helpful,
Yeah.
and kind of catching it initially. So I always think like avoidance altogether isn't necessarily helpful, but
Hmm.
actually recognizing that I'm overthinking,
Mm,
labeling it as unhelpful, it's not helpful. It's leading me to place that isn't helpful or enjoyable or making me feel good. So
mm,
actually I need to then sort of action it, don't I? So could I write that down? So if I'm overthinking but it's worries, I
mm,
might have a worry diary. I might write those things down. If it's
mm,
a thought, if it's something that I can action, so I don't know, I owe my friend some money and I'm thinking about it. Oh, I really need to sort that out. I really need to pay this money and I've got to do da, da, da. Can I just action it and do it and then it's done? So it depends on what we're overthinking. Is it rumination? Am I overthinking all these past events that have happened, or am I worrying about future events? So being able to sort of recognize those, catch that, and kind of label it. Tell myself it's really not helpful. I'm doing that thing again where I'm just overthinking loads of stuff. It's not helpful. I'll catch it. I'm going to stop doing that now. I'll either write down those things or I'm going to park them. So it might be I imagine putting them in a box, or I've got a way of kind of parking that over worrying, and I'm going
mm,
to change my focus of attention, which I would argue is different to just avoiding the thoughts altogether because they're just
mm,
going to keep coming back up. So if I'm
mm.
sort of recognizing, labeling, and actioning it in some way, that
So that's
can
really
be
useful.
helpful.
Sometimes I write things down, and if I'm going over and over in my mind, and I put them down, and maybe do something really simple like make a to-do list or prioritize prioritize things, put them down. Then I think, okay, I tell myself I'm not going to think about that anymore because I've written it down. It's in my list or in my what I like to think of as a worry box, and I've put it away now, and I've closed my box. And is that useful? Could that be something simple and useful to do? People asking about studying, procrastination. If I made a list, this is my priority. I'm going to do this, and those sort of little tricks and tools. What do you think? I mean,
Yeah,
could you give us
definitely. Yeah, yeah, I think that's great. Yeah, sort of trying to write things down. There's postponement,
some?
so I might allow myself, might say to myself, right, all these things that I'm thinking about, I'm going to give myself a time slot at 6 o'clock every day where I'm going to allow myself 10 minutes to think about all these things. And if they crop up outside of that time, I'm going to direct them to, it's not my time to think about these things now. I've got this time set aside.
Mm,
I'm going to do that then. I think one of
mm,
the other things with sort of overthinking and getting into those patterns are
mm,
what are the behaviors associated? So again, are we just sitting watching TV all night, or are we kind of just sitting dwelling, giving ourselves lots of time to think
mm,
about things? And actually, what could be more helpful? My favorite question in CBT is what's the most helpful thing for me to do? Is it helpful for me to be sat here
mm,
ruminating about this relationship I had or this thing that happened at work today? Is it helpful? Probably not. What can I do that's maybe a bit more helpful? And I'd want to
mm,
look at sort of my activity. If that's happening a lot, what are we
mm,
doing sort of day to day to try and, what does my diary look like day to day? So this is where we'd maybe look at some behavioral activation. What
mm.
could I do with my time that's more enjoyable? Do I enjoy reading? Could I do some art? Are there kind of simple things I could do to replace that time?
That's great, really useful and tips. And just I'm just going to go a little bit back, and we're running a little bit out of time, so I'm going to just as a psychiatrist to say, in my opinion, this kind of therapy can be fantastic, really useful, and potentially, I think you said earlier, before we started, Natalie, it can be life-changing, and I agree with that. It really can be, and I've seen that with so many of my patients over the years. As a psychiatrist, I would say, would be careful about not using it. This is just, just from uh, a taking care point of view. Somebody with, let's say, who's very psychotic or florid psychosis, I don't think necessarily would be beneficial. Somebody with severe or significant cognitive difficulties or brain injury who can't doesn't have those cognitive resources. Somebody in crisis, I would say, also not suitable for CBT, and somebody with excessive use of high use of drugs and alcohol, so that they're so much so that they're affected by that a lot of the time or throughout the day. Or you agree with those sort of categories that you wouldn't want to see
Yeah,
some
definitely. And I
necessarily
think people have got to be motivated as well. It's
motivate.
very driven by the
You've got to do
individual.
the homework, because if you don't do the homework, it's
There's
not good.
homework.
There's homework
Yeah.
and you've got to work hard at it, and that's really important. And it's not just sitting there saying, "Cure me, Natalie." It's not like that. So,
Yeah.
so,
But I
so
think you're right. People have got to be sort of
yeah,
at a balanced place where they can engage. You've got to be able to engage. You've got to be able to kind of
yeah.
retain and take away that and work on that over the week because most change happens in the weeks in between
Yeah,
sessions.
the outside
Yeah.
time, isn't it? But we've got
Yeah.
loads of questions, but I'm gonna end. And people keep asking about tools and things, and they can keep popping questions in, and we can try and also sometimes answer outside. But we need other sessions on CBT, and you mentioned EMDR and all these things. But I'm gonna end it on, if people need help, because that seems to be one of the main sort of things people are asking for. How do they go about getting help? What sort of where would you advise people to sort of access CBT and resources from?
Yeah, good question. I
Mm,
think always check that a therapist is a true therapist. So the BABCP website that shows everyone that's accredited, that's on the register, that's done the training, that's insured, that's legitimate to kind of be able to do
mm,
therapy with.
mhm.
So definitely, you can just search a therapist on there. You just put in the name, search them. You'll be able to find people on there to make sure they are
Yeah.
properly registered and accredited.
Hmm.
NHS talking therapies, so you can self-refer
Yeah.
for that. Usually they're different in each area, so depending where you are, if you ring the GP, they'll be able to kind of put you in touch with the right
Mm,
people depending on that area.
mm,
Um, you can seek private therapy, so
Yeah.
through Oxford Psychiatry Group or other, reputable companies that deliver CBT. Um, yeah.
So one quick question there, just before we end, is somebody's asking, I think this is very common, attention and concentration, focus and concentration. Is that it can CBT help with my focus and concentration if my mind wanders all over the place? I'm talking about myself. Let's say, I mean, as a human being, I think our mind always goes sometimes where we don't want it to go and come back to the task at hand. Can CBT help me with that?
Yeah, I think one of the key things for me is like someone's put like what the top someone's asked what the I'm trying to read the chat as well.
Yeah.
Top tips. I think top tip is
Mhm.
recognize can we recognize our thoughts, feelings, and behaviors in a related to a situation. So if we need to catch ourselves in that situation, don't we? So our mind's wandering, I'm thinking about 20 different things, but I've got a big list of stuff here to do. Well, how can we work with that? We've got to kind of recognize that we're doing that in order to change it. Does that
Mhm.
make sense?
Yeah.
So,
So insight
um,
really is important as
insight,
well.
yeah, being able to kind of catch that. And, like things like, I think there's some comments about like writing essays and, like at work doing I don't know, I've got to write a report or something like that.
Hmm.
Um, we need to try and have time where we're focused on that, but also can we focus on what other things are we doing as well? So maybe not at work, but outside of that, can we be doing other enjoyable activities? Can we allow ourselves time and be kind and compassionate to ourselves to break time up and have things that we enjoy doing? Because if we've got 8 hours in a day and I'm saying, right, I'm going to do a revision for 8 hours, chances are that's not going to be very productive. Whereas if I set myself my little environment, got my little station where I'm set up, it's not in my bedroom or in my lounge where everybody's wandering around.
Yeah.
We've got to kind of, can we commit to that? Can we set a plan? So we can work on things
Mm.
along those lines to try and help with that.
Mm. You touched on, so I think some really important things. And one of the things that I think we should do a whole different webinar on or discuss is mindfulness and mindfulness-based CBT, but mindfulness in itself. I think that's a big topic. EMDR we touched on, but practically, I think for people who are watching this either now or later, so if you have any difficulties, obviously your GPs are one of the most important people you can go and see. They can refer you to what used to be called IAPT, is now called talking therapies, and that's within the NHS. And there are, literally millions of people have been referred to talking therapies, which can be very useful. What I would like to personally add, though, is from my experience of many years in the NHS as well, is that if you have more complex, or I mean, Natalie, you mentioned fantastic idea of just surface CBT, and then a more sort of involved level of CBT. I think within as good as the NHS services are, if it's a straightforward kind of equation, they can be very helpful. But if it's more complex, let's say somebody dealing with difficulties in complex mixed episodes of, just for example, bipolar or ADHD, neurodivergence, autism. For example, there's no point saying to many autistic people, well, asking them to do well, use technical term introspective metacognition, because it doesn't mean anything. It's like, what evidence do you have for that thought? And they think, well, I don't really, that doesn't equate. And we want them to perhaps do some behavioral activation or behavioral type of changes rather than just. So for those kind of more complex things, I would strongly recommend everybody think very carefully about your therapist. Like Ashley said, go to those organizations she mentioned, ask questions of us at Oxford Psychiatry, of Natalie, if you wish to, and finding that right therapist and adapting that CBT for those particular conditions. And it does need to be adapted to be really successful. And that relationship, that rapport with the therapist, I think those things, from my point of view and understanding, are really, really crucial to successful outcomes in high quality CBT. Do you agree? What do you think, Natalie?
Yeah, yeah, absolutely. Yeah, I think it's finding the right therapist for you and what you're working on. And some people will kind of specialize in different areas as well. So, it's kind of looking out for that and yeah, y- you know, I think if people were to ask me what are your qualifications, what's your background, you do your research and I think genuine good therapists would be more than happy to kind of
Yeah.
give you that information and tell you that and share that with you. So yeah.
That's fantastic. I mean, there's so much more we could talk about, and I think this just raises up the clear evidence that actually we need to break probably CBT down a little bit further, or therapy, and then talk. I mean, EMDR is another big one I'm really interested in, and then mindfulness, and then different aspects of CBT. So, people who are watching, please do keep your questions and queries coming in, and wish you all the best with your CBT journey if that's what you're doing. And if not, then general interest and questions are welcome too. I really want to thank everyone who's attended, but Natalie, I want to thank you for your expertise and how well and you explained it. Even I understood most of that. So I think that's really, really fantastic. And thank you so much. But thank you everybody who's joined us live. And you can watch this later on our website on Oxford Psychiatry Group. There's a webinar page, so it will be put there by our IT people. So thanks everyone for joining, and above all, thank you so much, Natalie, for giving us the benefit of your expertise and wisdom today.
Thank you for having me. It's been lovely. Thank you very
I
much.
hope to do it again soon. Everyone, take care.